Hello everyone, welcome to my another video. Today we discuss about special MCQ for upcoming NORCET 2023. This is part 2. For more important MCQ on nursing subjects, make sure you subscribe to this channel. Question number 11. A 76-year-old male client asks the nurse about the chances of getting osteoporosis like his wife. Which is the best response by the nurse? Option A. This is only a problem for women. B. Exercise is a good way to prevent this problem. C. You are not at risk because of your small frame. D. You might think about having a bone density test. Right answer is option D. You might think about having a bone density test. Osteoporosis is not restricted to women. It is a potential major health problem of all older adults. Estimates indicate that half of all women have at least one osteoporotic fracture, and the risk in men is estimated between 13% and 25%. A bone mineral density measurement assesses the mass of bone per unit volume or how tightly the bone is packed. Next question. A client is prescribed prolonged bed rest after surgery. Which complication does the nurse expect to prevent by teaching this client to avoid pressure on the popliteal space? Option A. Cerebral embolism. B. Pulmonary embolism. C. Dry gangrene of a limb. D. Coronary vessel occlusion. Right answer is option B. Pulmonary embolism. The pulmonary capillary beds are the first small vessels that the embolus encounters once it is released from the calf veins. Next question. What should the nurse teach a client who is taking antihypertensives to do to minimize orthostatic hypotension? Option A. Lie down for 30 minutes after taking medication. B. Avoid tasks that require high energy expenditure. C. Sit on the edge of the bed for 5 minutes before standing. D. None of the above. Right answer is option C. Sit on the edge of the bed for 5 minutes before standing. Sitting on the edge of a bed before standing up gives the body a chance to adjust to the effects of gravity on circulation in the upright position. Next question. A client describes abdominal discomfort following ingestion of milk. Which enzyme should the nurse consider to be the cause of the client's discomfort? Option A. Lactase. B. Sucrase. C. Maltase. D. Amylase. Right answer is option A. Lactase. Milk and milk products are not tolerated well because they contain lactose, a sugar that is converted to galactose by the enzyme lactase. Next question. A client is to have gastric gavage. In which position should the nurse place the client when the nasogastric tube is being inserted? Option A. Supine. B. Mid-fowler. C. Highfowler, D. Trendelenburg. Right answer is option C. Highfowler. The Highfowler position promotes optimal entry into the esophagus aided by gravity. Next question. A nurse is teaching a client how to use the call bell system. Which level of Maslow's hierarchy of needs does this nursing action address? Option A. Safety, B. Self-esteem, C. Physiology, D. Interpersonal. Right answer is option A. Safety. A call bell system helps the client to communicate with the staff and support safety and security, which is a second level need. Next question. A nurse is reviewing a client's plan of care. What is the determining factor in the revision of the plan? Option A. Time available for care, B. Validity of the problem, C. Method for providing care, D. Effectiveness of the interventions. Right answer is option D. Effectiveness of the interventions. When the implementation of a plan of care does not effectively produce the desired outcome, the plan should be changed. Next question. How can a nurse best evaluate the effectiveness of communication with a client? Option A. Client feedback, B. Medical assessment, C. Healthcare team conferences, D. Client's physiologic responses. Right answer is option A. Client feedback. Feedback permits the client to ask questions and express feelings and allows the nurse to verify client understanding. Next question. A nurse administers an intravenous solution of 0.45% sodium chloride. In what category of fluids does this solution belong? Option A. Isotonic, B. Isomeric, C. Hypotonic, D. Hypertonic. Right answer is option C. Hypotonic. Hypotonic solutions are less concentrated than body fluids and it contains less than 0.85 gram of sodium chloride in each 100 ml. Next question. A client had extensive prolonged surgery. Which electrolyte level should the nurse monitor most closely? Option A. Sodium, B. Calcium, C. Chloride, D. Potassium. Right answer is option D. Potassium. Release of cortisol by the stress of surgery causes excretion of potassium. So this is the today's video. Thank you so much for watching my video.